Hey, if you're landing in this video, you might be already diagnosed with iron deficiency anemia or having certain symptoms for long. But don't worry. Today we are going to give you a simple, practical tips to cure your iron deficiency, helping you in your diet plan. Not a boring list. Stay tuned. Welcome back to Anemia Decoded series at DocDecoded, where we decode health myths, simplify science, and occasionally roast leafy greens for being underrated superheroes. So tell me, do you feel tired all the time? Even after 8 hours of sleep? Do your nails chip like dry biscuits? Or maybe you've been hearing more, you look pale, then you look great lately. So let's eat our way back to energy. Did you know that 1 in 3 women and a growing number of men suffer from iron deficiency anemia? Often without even realizing it. It's not just fatigue. It can affect your concentration, hair health, mood, and even your heart. Watch out our full video on basics of iron deficiency anemia before getting your diet plan. And guess what? Most cases can be reversed naturally. Through food, no needles, no supplements, just smart, tasty eating. Sounds good? The first attempt of iron deficiency prevention is always through diet. Other methods of cure comes later. Then let's decode your iron-rich meal plan, DocDecoded style. Let's start at sunrise. The iron kickstarter. Forget tea and coffee. Sorry, aunties, we're starting the day with a glass of fresh orange or amla juice. Why? Because vitamin C is like the wingman for iron. It helps it absorb better. Hey, just a one caution here. If you're suffering from bloating or hyperacidity condition, you should definitely avoid or take it alternate day. Pair your morning vitamin C booster with 4 soaked raisins and 2 dates. It's like a mini iron bomb. Tiny but mighty. And pro tip for you, cook your food in an iron utensils. It actually increases the iron content. Grandma knew what she was doing. Breakfast of champions, 8 to 9 a.m. Let's eat like royalty. Iron royalty. You've got 2 kingdoms to pick from. If you're from eastern zone of the world, especially Asian or Indian. In the vegetarian court, you can include moong dal chilla with mint chutney, spinach paratha with curd and lemon or amla pickle, poha with peanuts and vegetables plus squeezed lemon, raji, finger millet, dosa or idli with coconut chutney, besan or gram flour chilla with mint coriander chutney, or iron-fortified oats topped with chopped papaya and a handful of seeds, or jaggery plus sesame seeds plus roasted chana as a snack or side you can include sometimes. In non-veg dynasty, boiled egg, sautéed spinach and whole wheat toast. Or chicken liver curry. Surprisingly, it's one of the richest sources of heme iron. Western iron-rich vegetarian breakfast option. Can be oatmeal with pumpkin seeds, raisins and strawberries, or whole grain toast with hummus, bell pepper slices, or smoothie with spinach, banana, chia seeds, and orange juice. Iron-fortified breakfast cereals with plant-based fortified milk or avocado toast with tofu scramble and tomato can definitely be your favorite breakfast. Sidekick. Squeeze lemon juice over everything. Seriously, it's your iron's bestie. Turkey bacon or sausage with whole grain pancakes, berries or chicken liver on toast with orange slices can be your best non-veg platter. Mid-morning mini feast. 11 a.m. Energy dipping or getting bored? Don't reach for chips. Instead, go for a guava, pomegranate, or a sliced apple. Add a spoon of roasted pumpkin or sunflower seeds. Or make a quick fruit chaat. Throw in some lemon, chaat masala, and boom! Snack with benefits. What's your go-to snack? Let me know in the comments. And don't say air. I know some of you are skipping meals. Lunch that loves your blood. 1 to 2 p.m. Now this is where the real iron feast begins. The plate of power. Are you from Eastern world? Try 2 multigrain rotis or 1 bowl brown rice with chana curry or mixed dal. Adding a mixed veg of spinach, methi or moring, raw beetroot and cucumber salad with lemon juice. A bowl of rajma, kidney beans, curry, bajra roti, curd, yogurt or chas or chana masala, jeera, rice plus, cucumber onion, tomato salad, beetroot paratha, mint coriander chutney with yogurt or khichdi of moong dal plus veggies, and lemon veg with papaya salad can be your choices. Western veg. Iron-rich lunches can be quinoa salad with chickpeas, spinach, bell peppers, lemon dressing, or whole wheat wrap with hummus, roasted veggies, and kale lentil soup, whole grain bread and orange slices, or tofu stir-fry with broccoli and bell peppers, and brown rice or stuffed bell peppers with beans, corn, tomato salsa you can take. Western, non-veg, iron-rich lunches can include grilled chicken breast with quinoa's roasted Brussels sprouts, or beef chili with beans was whole grain, bread with citrus fruits, or tuna salad sandwich of whole wheat, bread plus, orange juice, or a turkey and spinach wrap, tomato soup, or egg and avocado toast, sautéed kale and berries, etc. And remember, no tea or coffee within 1 hour before or after meals. It binds iron like a bad ex, hard to let go. Evening pick-me-up. We're avoiding those caffeine cravings. Instead, go for roasted chana, masala makhana, dry fruit mix with 2 to 3 dates, sprouted moong salad with chopped tomato and lemon. Optional drink, tulsi or ginger tea, warm, soothing, and non-iron blocking. Drop a in the chat if you've ever been betrayed by evening coffee headaches. Dinner done right. Let's keep it light, but still loaded with nutrients. Options. Palak tofu, curry with roti, vegetable dal khichdi with a twist of lemon, or quinoa salad with sprouts, bell peppers, and coriander. Bonus tip, avoid lying down immediately. Let your gut digest the goodness. Late night craving? If you're the midnight munching type, one dry fig or a date or warm turmeric milk. If you're not lactose intolerant, keep it light, keep it calm. And yes, Netflix does not count as a sleep supplement. Weekly power boost. Now if you want to level up, add these to your routine 2 to 3 times a week. Beetroot and carrot juice with lemon, black chickpeas gravy or salad, sprouted fenugreek and moth beans. Chicken liver masala, if you're non-veg, super high in him iron. Also, check for iron-fortified foods in your local grocery store. Many cereals and flours now come enriched. Hey, remind you, if you're having too low hemoglobin, only iron-rich food won't work well. You have to take iron supplements for early recovery and future storage in your body. If you haven't yet visited the last video, do watch it. You can prevent yourself from future suffering by decoding your cause. 2. Iron supplements. Typically, for iron replacement therapy, up to 200 mg of elemental iron per day is given, usually in the form of ferrous sulfate or gluconate in divided doses, each containing 50 to 65 mg elemental iron. But here's the mistake: taking iron with food. Food reduces absorption. A dose of 200 mg of elemental iron per day usually results in absorption of iron up to 50 mg per day only, so it is necessary to remove any reason which prevents iron absorption. So take iron on an empty stomach. And yes, it may cause constipation or dark stools. Totally normal. The goal of therapy in individuals with iron deficiency anemia is not only to repair the anemia, but also to provide stores of at least 0.5 to 1 gram of iron. Sustained treatment for a period of 6 to 12 months after correction of anemia is necessary to achieve these. Therefore, do not stop medicines by yourself if you are suggested a long course, even if you've reached normal hemoglobin level after a certain period. Of the complications of oral iron therapy, gastrointestinal distress is the most prominent and is seen in at least 15 to 20% of patients. Abdominal pain, nausea, vomiting, or constipation may lead to non-compliance. Pair it with fiber-rich foods and stay hydrated. Or ask your doc for gentler options. Your doctor may do a test in the clinic to determine your ability to absorb iron, known as iron tolerance test. Here, 2 iron tablets are given to the patient on an empty stomach. Serum iron is measured over 2 to 3 hours. Normal serum iron will increase 100 micrograms per dl for normal absorption. If iron deficiency persists despite adequate oral treatment, it may be necessary to switch to other forms of iron therapy. 3. Parenteral iron therapy, iron injection or IV drip. Some people can't take iron tablets, oral iron, because they either don't tolerate it well or their iron needs are very high. These people might need iron through injections or an IV drip. This is called parenteral iron. This type of iron treatment has become more common in recent years, especially because certain patients, like those on a medicine called EPO for anemia, need more iron than their body can naturally absorb from food or oral supplements. Now, safer and better options are available like ferumoxytol, ferahim, sodium ferric gluconate, ferlechit, iron sucrose, venofer, low molecular weight iron dextran in Fed, ferric derisomaltose, monofer, ferric carboxy, maltose, injectafer. Each of these delivers different amounts of iron. The exact amount of iron a person needs is based on their body weight and how low their hemoglobin is. There's a formula for that, and the doctor calculates it for you before prescribing. These newer types cause fewer problems. Each of these delivers different amounts of iron. How is it used? There are 2 main ways: to give a big enough dose to quickly correct low hemoglobin and refill iron stores, to give smaller doses regularly over time, especially for patients like those on dialysis who need frequent iron to help treatments like EPO work better. Possible reactions to iron injections, IV iron. When giving iron through an IV into a vein, there's a small risk of a serious allergic reaction called anaphylaxis. The good news is that this is rare, especially with newer iron types. Who is at risk? People who have many allergies or had a reaction to iron before are more likely to react. Sometimes, people may feel unwell a few days after getting a large iron dose. Symptoms may include joint pain, skin rash, mild fever. These side effects are usually not serious and don't mean the person can't get iron injections again. However, important to note that if the person shows signs like chest pain, wheezing, drop in blood pressure, or other serious symptoms during the iron drip, the treatment should be stopped right away. What if someone is sensitive to one iron type? They can often safely try a different kind of iron injection. Special care with certain types. If someone is getting a large dose of a specific iron type, like low molecular weight iron dextrin, it must be mixed with a fluid, like sugar water or salt water, and given slowly over 60 to 90 minutes. Usually, doctors recommend a small test dose, 25 mg, first to check for any reaction. But in real life, giving the full dose slowly works just as well to watch for side effects. Getting questions in mind? Drop in comment. Like this video if you learned something new, share it with someone who's always tired and blames their stars. Comment below. What iron-rich food are you trying first? Remember, don't just treat your body, understand it, decode it. And don't forget to subscribe to DocDecoded for more health tips with a dash of fun. See you in the next one. Stay healthy, stay energized.